How's everyone doing? Do we like marching Houston?
Yeah!
Do we like telling Houston that we will stand up for our patients? We will not stand where our patients being under attack. Are we ready to fight for health care? Are we ready to stand with amazing other activists fighting for health care? We have a great program for you today. I'm very, very, very excited. So, welcome. So, for whom is this the first AMSA rally? Raise your hand. This rally is for you. So, we're standing here with a few other amazing organizations, one of which is still stuck in traffic. But I'm so happy to share the stage, share the plaza with the Service Employees International Union, Justice for Dancers in Houston. As you may know, SEIU is the largest union in the country and is the union with the most healthcare workers. It's also the home of the Committee of Interns and Residents, who are our dear friends and organize house staff in hospitals across the country. Today, not only are we celebrating that medical students, that pre-medical students, that interns, that residents are not going to take a tax on our patients, are not going to stand for putting profits before people. We're also celebrating a great, great victory for this amazing union. Yes. SEIU, 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 SEIU. So there's two fights we're going to talk about. The first one was victorious. The second one will be victorious. So the janitors just won a great victory last year, 2006. Where they got from their employers healthcare benefits. Workers who stood up, fought back, and won healthcare. What do we think of that? The next fight is for the Aramark workers who are standing up, fighting back, and will get healthcare, and a whole lot of other victories. So, first in the program, one of the best speakers I've ever seen speaking at rallies, a huge friend of mine, your amazing AMSA president, Dr. Michael Ehlert.
Flavia, you need to go to some more rallies because there's far better speakers than me. Ladies and gentlemen, it is no secret that our healthcare system turns away 47 million people at the door. Let me tell you something. The questions of quality in healthcare, the qualifications of your physician, the drugs on your formulary, it doesn't mean much when you don't have a doctor. Now, sure, we won't shut the door on you if you're mangled, if you're bleeding, if you're unconscious, if you get brought into the emergency room. But tell me this, is it better to treat someone's asthma and lower their cholesterol and give them insulin? Or is it better to admit them to the ICU for respiratory failure, to perform bypass surgery on their heart, or to amputate their diabetic leg? We need to take care of our patients when they need us to take care of them. Who's got a t-shirt on from this convention up here? Come here. All right, everybody. You guys have seen this around. Those of you who are joining us on the stage, this is a healthcare revolution. When your society no longer reflects your values and no longer cares for each other, you are bound to rise up in a revolution!
Revolution! Healthcare revolution!
Will you join me today in calling for care for all of our patients? Will you join me today in demanding that our representatives, that our elected officials, that our public servants design a system to care for all people? Will you be part of this revolution? And will you be part of this revolution? Ladies and gentlemen, friends, colleagues, Houstonians, thank you. Thank you for joining with us here today to raise up your voices for those who have been forgotten, those who have been left out and cast aside by a for-profit healthcare system, a system which places profits over our patients. A system which tells us who we can care for, when we can care for them, how we can care for them, in what manner we can care for them, and if we can care for them. You know, we're going to be facing these challenges throughout our careers. Despite the campaign speeches, despite the lobbies, despite the coalitions, there are millions more people uninsured than the day that I started medical school. I ask you, is this how you want to look back on your professional career? Is there an organization out there taking to the streets with the next generation of physician leaders? I say AMSA, you say power. AMSA! Power! AMSA! Power! AMSA! Power! AMSA! Power! AMSA! Power! AMSA! Power! Are we going to wait for somebody else to fix this system for us? No! I'm proud to stand here today as a physician, as a member of this profession, and as the national president of your organization, the American Medical Student Association. Who has the power to take this on? We do! All right. So, you know, there's some people who think the physicians should get back to their clinics. We should get back to our wards. And we should stay out of this. Are we going to stay out of this? No! Are we going to stop until we can invite any patient into our clinics? No! We have a duty. We have a social pact that binds our profession to treat any person without bias, regardless of their ability to pay, regardless of their race, regardless of the neighborhood they come from, regardless of their ability to pay. And when our system stands against us and stands against our patients, we must use our power and be that revolution in healthcare. Who's got the power? We got the power. What kind of power? AMSA power. Who's got the power? We have the power. What kind of power? AMSA power. Who's got the power? We have the power. What kind of power? AMSA power. Who's got the power? We have the power. What kind of power? AMSA power. AMSA power. AMSA power. AMSA power. Woo!
How much do we rock?
A lot!
We are so awesome.
Awesome!
That